Are you suffering from a vitamin K deficiency? Vitamin K is essential for several bodily functions, including normal blood clotting and bone health. Because of an inability to form blood clots, heavy bleeding is the primary sign of a vitamin K shortage. Hey guys, welcome to Gainz. We are about to reveal everything you need to know about vitamin K. In this video, we explore the role that vitamin K plays in the body, as well as the signs and symptoms of vitamin K insufficiency and the possible remedies for that condition. Vitamin K deficiency is relatively uncommon in many people. Most people's diets provide them with an adequate amount of vitamin K. On the other hand, vitamin K insufficiency is more probable in babies. It is essential for a person taking a medication that thins the blood, such as warfarin, to maintain a consistent daily intake of vitamin K at the same level. But what exactly is this vitamin K? Vitamin K is available in two different forms. Vitamin K1, also known as phytoquinone, is found naturally in dark green leafy foods, like spinach and kale. Vitamin K2, also known as menaquinone, is naturally present in foods derived from animals, such as butter and egg yolks, and fermented foods such as kefir. The intestinal tract is also responsible for producing some of this vitamin. Both vitamin K1 and K2 are responsible for the production of proteins that aid in blood clotting. Coagulation of the blood, often known as clotting, stops excessive bleeding both internally and externally. It is more likely for someone to experience heavy bleeding if they have a shortage of vitamin K, since this condition indicates that their body cannot make enough of the necessary proteins. Most people can obtain vitamin K in sufficient quantities from the foods they consume and the amount naturally produced by their bodies. Certain medications and medical conditions can lower vitamin K production and inhibit absorption, indicating that grown-ups can also become deficient. Infants are at a much increased risk for developing vitamin K insufficiency. Vitamin K deficiency bleeding, abbreviated as VKDB, is the name given to this condition when it occurs. Reasons and potential hazards. Adults have a greater likelihood of developing vitamin K insufficiency and the symptoms that come along with it if they take anticoagulants, often known as blood thinners, to avoid blood clots, but note that these medications impede vitamin K's action. People who acquire inadequate amounts of vitamin K from the foods they eat because they take antibiotics that inhibit the generation and absorption of vitamin K. People who consume too high amounts of vitamin A or vitamin E. It is possible for some medical disorders, such as situations in which the body is less able to absorb fat, to increase the likelihood of developing a vitamin K deficiency. This condition is referred to as fat malabsorption. Conditions associated with fat malabsorption include celiac disease, cystic fibrosis, an intestinal or biliary tract, liver, gallbladder, and bile ducts disorder, having had part of the intestine removed, such as during bariatric surgery. Several factors contribute to the increased risk of vitamin K insufficiency in newborn infants, including the following: breast milk low in vitamin K. Vitamin K does not transfer well from the placenta to the baby. A newborn's liver is unable to use vitamin K efficiently. A newborn's gut cannot produce vitamin K2 in the first few days of life. Daily requirements and sources of vitamin K. According to the recommendations made by the ODS, adults should get the following amounts of vitamin K per day. Males should get 120 micrograms every day. Females should get 90 micrograms every day. The following are examples of foods that are rich in vitamin K. Veggies that are green and leafy, such as spinach, kale, lettuce, and broccoli. Vegetable oils. Fruits like blueberries and figs. Chickpeas. Soybeans. Green tea. Supplements of vitamin K are another option available to people. It's in your best interest to see a medical professional before taking them, as they may interact negatively with other medications you're already on. What are the symptoms of vitamin K deficiency? A lack of vitamin K can cause various symptoms in its victims. The most prominent sign is heavy or constant bleeding. It is possible that excessive bleeding will not be immediately noticeable because it might only take place if the individual is cut. The following are some additional indications that may indicate heavy bleeding. Bruising easily. Tiny blood clots appearing under the nails. Bleeding in mucous membranes that line areas inside the body. Feces that is dark black, tar-like, or contains blood. In addition, when searching for symptoms of vitamin K shortage in newborn babies and infants, medical professionals will check the following: bleeding from the area where the umbilical cord has been removed, bleeding in the skin, nose, gastrointestinal tract, or other areas, bleeding at the penis if the baby has been circumcised, sudden brain bleeds, which are deemed severe and potentially life-threatening. Diagnosis. When attempting to diagnose a vitamin K deficiency in a patient, a doctor will first inquire about the patient's medical history to see whether or not the patient has any risk factors. The PT test, also known as the prothrombin time test, is a coagulation test that the physician could do. After collecting a small amount of blood, they mix in some chemicals and watch how long it takes to clot. The average time it takes blood to clot is between 11 and 13.5 seconds. If it takes significantly longer than this, it may suggest that you need more vitamin K. Before having this blood test done, it is recommended that individuals abstain from eating food that contain high quantities of vitamin K. Treatment. A vitamin K supplement known as phytonadione will be prescribed to a patient by a medical professional if the individual develops a deficiency in vitamin K. Oral administration of the supplement is the most common method, but injections are also an option if the body of the individual has a reduced capacity for oral supplementation. The appropriate dosage is determined by considering the patient's age and general health. According to a reliable source, the typical dose of phytonadione for adults ranges from 1 mg to 10 mg, with a possible second intake after 12 hours. Because anticoagulants and vitamin K might interact, a doctor will also ask if the patient takes any of these medications. Vitamin K and newborns. Vitamin K can avoid a deficiency in newborn babies if given to them shortly after delivery, typically in the form of an injection. At birth, it is recommended by the American Academy of Pediatrics that neonates receive a single injection of 0.5 to 1 mg of vitamin K1 as a single dose. When specific conditions are present, newborns must have a vitamin K shot. Some of the risk factors for bleeding caused by a vitamin K deficiency include preterm delivery, use of anticonvulsants, anticoagulants, or medication for tuberculosis by the mother during pregnancy. Infants unable to properly absorb fat because of gastrointestinal or hepatic disorders. Newborns who are not given a vitamin K shot shortly after delivery. The decision of whether or not to administer a vitamin K injection to their child lies solely within the purview of the parents. Experts strongly recommend the administration of the injection since it reduces the risk of serious complications, including cerebral bleeding, brain damage, and even the death of a newborn. If you're interested in discovering more about nutrients that your body needs, especially if you're a vegan or thinking about it, then be sure to check out these videos too. I'll see you there!